Hello, everybody. My name is Bonnie Larrimore. I am the parent educator for the Eastern Shore of Maryland, for the Parents Place of Maryland. I have been involved in this work for a very, very long time, including having a child with multiple disabilities, a connective tissue disorder called Marfan, diabetes, autism, and many other types of disabilities. My son passed in 2014, but I am continually doing this work to assist families. I would like to introduce my colleague, Leilani Hardy.
Hello, thank you, Bonnie. I'm happy to be here today with everyone. My name is Leilani Hardy, and I am also a parent educator for the Parents Place of Maryland, and I serve the Lower Shore region, which are Wicomico, Worcester, and Somerset counties. I have 3 children, twins that are age 9 and a son that is 13. They all 3 have a few different diagnoses with mental health, and also joining us today will be Sophia Daimler, nurse practitioner. And a little bit about Sophie is that she has a Master's of Science in Nursing, as well as she is a certified nurse practitioner at Ansari Pediatrics in Salisbury, Maryland. The practice serves patients from a primarily urban demographic, with the majority of patients covered by Medicaid. And Sophia has just joined this practice in March of 2020. She obtained her Master's of Science Nursing degree and Family Nurse Practitioner track from Frontier Nursing University in November 2019. She received her Bachelor of Science Nursing degree from Messiah College in 2012. Prior to becoming a nurse practitioner, she had worked as a registered nurse within the hospital setting, with most of her time being spent and focused in the emergency department and hospital administration. Sophia has recently moved to the Lower Shore area in Salisbury, Maryland, with her husband, 2 children, and she has a French bulldog. She loves to garden, read, and spend time with family and friends, chatting over a cup of hot tea. And now I will let Sophie say hello as well. Good morning, everyone.
Sophie, thank you so much for doing this with us today. So I will be going through, along with Leilani, a few slides to let families know who Parents Place is, and then we will turn the event over to you, Sophie.
The mission of Parents Place of Maryland is to empower families as advocates and partners in improving education and health outcomes for their children with disabilities and special health care needs.
Who is Parents Place? We are the Maryland Education and Health Information Center. We were established in 1990. We are an organization governed by parents. Our team is made up of parents and close family members of children with disabilities and special health care needs.
Parents Place of Maryland offers different services such as one-on-one assistance to families, resource sharing, leadership training, parent partners, families as faculty, and military outreach.
How do we help families? We help families to better understand their children's disability, education, and healthcare needs. We teach them how to communicate more effectively with schools, their doctors, and other related professionals and agencies that are involved with their children. We also help them understand their rights and responsibilities under special education law and the regulations. Understand their rights and benefits in the healthcare system. Obtain appropriate services for their children, which would be individualized for your children. Sometimes we need to help them resolve disagreements with the school system, and other agencies that they may have involved in their child's life. We connect with other community resources and help the parents by giving them resources and information.
For more information on the Parents Place of Maryland, you can contact us a few different ways. You can contact us by phone and by our website, as well as Bonnie Larrimore, which her information and email is listed below as well.
Please take an opportunity to go into our website and look at all of the different types of wonderful resources that we have. So welcome, Sophie. So we're going to turn this over to Sophie now and let her explain to us what are the benefits of telemedicine and telehealth.
Thank you, Bonnie. Thank you, Leilani. So to start this, we probably first should address a question that you have, which is, what is the difference between telehealth and telemedicine? I'm sure you've heard a lot about it, and your doctor's offices have started to offer it more and more with the recent COVID pandemic. But to start, the difference between telehealth and telemedicine is telehealth is more similar to what the services that are offered with Parents Place. And so it's more of your community outreach. It is more for your health and wellness and standard care that way. Telemedicine is more something that I provide and that you may have encountered in your pediatrician's offices or specialist offices, where we can do an assessment over the computer screen, over your camera screen, make a diagnosis. We can prescribe you medicines electronically to the pharmacy. So very similar to a medical visit that you would have in a medical office setting, other than we're not face-to-face, we're just through a camera. So access-wise, all it usually takes is a camera of some sort, a smartphone, laptop, computer. Those are all options for a camera, and to have a voice access, a microphone on any of those devices. Now that kind of takes you right into what some of the barriers are, because we have some families and some households who either do not have internet connection, so therefore they cannot access the telemedicine or telehealth systems, or they don't have a smartphone that has that capability. There are many different, especially with the pandemic, platforms and websites that have been created that do this telemedicine and telehealth. Here at Ansari Pediatrics, we do DoxyMe. It is a free service to our families. It is HIPAA compliant, as many of the services are. We generally do not do FaceTime or Facebook Messenger, only because those applications cannot provide the HIPAA compliant services that we need in healthcare to protect you, to protect your child's medical information and all of your health needs. So specifically here on the lower shore, there are some rural areas. There also are some tropical storms, and we get a lot more rain and weather. And so I have found personally, through trying to do telemedicine with some of our clients here, is that sometimes our internet connection will be blown out for a few minutes, or the families will in their home. Or like I said, they have some internet, but it's not a great connection. I can't tell you how many times I've said to families, can you move by a window? Also living in apartment complexes and high-rise type of developments, just the internet service isn't as great as we would like it to be to accurately do the telemedicine and telehealth. However, there are some of the barriers, but there is a lot of positives that come from doing telemedicine and telehealth. One thing in general is just from a safety perspective. So as right now in the middle of a pandemic, it decreases some of that face-to-face contact and decreases our risk as providers from contracting and then therefore transmitting to other kids, concerning illnesses, but also from the family. It's less risky for them to come out into a doctor's office where most parents, that's where sick kids go. And so it keeps them from that fear of their child contracting something as terrible as COVID-19. just for a simple, especially some of our little ones with reflux or a rash, those type of things, or allergies. Those are things that, for the most part, telemedicine we can do over the camera. Sure, it is limited and it's not as beneficial as an in-office visit, but in the midst of a pandemic, it has been life-saving for a lot of our patients and for us as providers, so we can continue to be here to serve our community. Overall, our community here has been very agreeable to doing telemedicine. Like I said, the pandemic has really aided a lot of that. But the other piece is the convenience of it. So I have found that I see patients more frequently by telemedicine than I do in the office, because when we're a pediatrician's office, so our moms are like you guys, and if you have multiple children, all different age ranges, and back before quarantine and COVID, you have sports and you have, PTA meetings, and life is busy, and you have, 3 or 4 kids, all, toddlers, and they're whiny and they're upset and one's sick. It's so nice that I can just talk to you right in your home. You don't have to leave. You don't have to get anybody ready. And especially a fussy baby or a fussy toddler, they don't want to come. Fussy teenagers too, they don't want to come. So this is nice. We can just talk over the camera. Another kind of side thing that has been nice that I've seen is a lot of my teenagers have helped their parents. And so almost from a bonding perspective that I've seen, where the parents can't figure it out, but the teenager and them have kind of worked together to learn how to address the mic issue or the camera issue. So I feel like I've seen more of their in-home family dynamic, which is nice, because I don't get to see that in the medical hospital, in the office setting. I don't know what life is like. They just tell me, but I don't get to see it. And so by doing telemedicine, I've gotten to get a little bit of some eyeballs into their house and into their home, and what life and if it's hectic or busy, or if it's, clean, some of those things that I can only take what they say in the office, but telemedicine has helped bring that full patient care in. One of the barriers, at least with DoxyMe, that we haven't been able to address is a language barrier. And so interpretive services have been a roadblock for us, and I'm thinking many other practices, finding a way to communicate with those who are not English speaking or very little English speaking. Number one, to educate them about how to use this technology, even just to log onto the site is difficult to do over the phone, much less if they are able to get on, there's just your language barrier there where we don't have interpreter services. What we have done here at our practice is for those families, so that way those children do not get missed, is that we bring them into the office. It's a little bit more risky to do that, but at the same time, if we cannot effectively do telemedicine, we don't want to take a risk that we're missing something, or that a child's sick and not getting the care it needs. So we have personal protective equipment here that we can use to bring families in. I believe that's it. Is there anything else you guys wanted me to talk about?
I would like to ask the question, Sophie, you have a very large Haitian community in your area.
Yes, ma'am.
Have they been able to access telemedicine or telehealth, or is that one of the concerns in regard to the language barrier?
Yes, so some have, but not many. When I was speaking about that, some of those families we just bring into the office, that was exactly who I was thinking of, is a lot of our Haitian families. Like I said, obviously they have some of them speak English, but they have a very thick accent, which is difficult to discern over the phone. And so our office staff, it's a struggle to try to get them to understand how to log in and do telemedicine. Also, just culturally, it's not anything that they're used to. It doesn't even sound normal that you would log into a website to talk to your doctor. It's a new thing for everyone, and especially those from other countries. So those individuals, our office staff usually brought into the office so we could talk to them that way.
So in your practice, or in general, you accept Medicaid, correct?
Yes.
Okay. Do you accept any sort of private insurance?
Yes.
Okay, great. Let me see.
I would say we're about 80% Medicare, Medicaid?
Yes.
Yep.
I think from my experience of growing up on the shore and then working with Parents Place, the majority of the families that I have worked with and continue to work with on the shore, very few have private insurance. Most of them are Medicaid kiddos or families. Let me see. So it looks like you're dealing with some cultural concerns. So as Parents Place, we are trying to address some of those concerns with the Haitian community. We have some projects that we have worked with in the past, but kind of been put on hold like everything else with COVID. But we all understand the need to help those families. Let me see. Anything else, Leilani?
I think I only had one question. It was just, and all the families that are not only from Haitian background, but from other backgrounds, have they seemed to be okay with telehealth, and do they have like a good understanding of it? Even though, like you said, for, in different cultures, that it may not seem normal or safe to them.
Right. So, generally, we have a large Hispanic community in this area as well. And so we haven't had as many barriers that I have noticed with our Hispanic community. They've been able to participate in telehealth. They're engaged in it. I've been able to, treat their children through it. So I haven't noticed a difference in that community. Our African American community also adjusted very well. So only generally those either Haitian or we have a couple African families. So just those that aren't from the U.S. Or are first generation in the U.S. that we've seen some of the barriers.
And if they can't access telehealth, like say if they don't have internet or a phone with a camera, do they just come in to be seen?
So we do it on a risk-based assessment. Our goal is always to see the child and to visually assess them, because I have the best chance at making an accurate diagnosis if I can actually see the child. However, there have been times where if the child is high risk for COVID, and a lot of our minority families, the parents work at the poultry farms. And so that is where a huge risk for COVID has been. And so if the parents have tested positive, and the child now has a fever, there is some level of protection for our office that we can't necessarily bring those children in. And what we can do is sometimes just over the phone, if I feel like we can get a clear assessment over the phone. Things have changed through COVID with our ER, and they generally didn't want us just sending kids just for testing. Obviously now testing's being offered all over the place, anybody who wants it. So, there were some barriers there, but I can say that for the most part, I could either talk to them on the phone and have them do some things for me over the phone. I'll say, hey, look here, let me know what you see, or look here, do you see a rash here? What's the rash look like? Is it red? Is it same color as the skin? And get them to kind of describe it to me and help them as best as I can. And usually those patients I see a lot more frequently. I'll call them tomorrow and the next day and the next day, just to make sure that child's not getting sicker. We've been very blessed here in our office. We've had some COVID positive patients, but none have been really symptomatic at all. So it's been a blessing for us, but we have monitored them very closely.
That's great news to hear,
Yeah.
Sophie. So I think you did a wonderful job, and we really appreciate you taking your time out of your day and also helping to educate us as parent educators on what the barriers are and how we need to work on them. So again, I want to thank you. I also want to thank PAC 14 for allowing us to do this today. Also, There will be also more events, so stay tuned for that information as those dates and times and topics come about. So thank you very much. Do you have anything to say, Leilani?
I just put our contact information up again should anyone have any questions or if they would like to reach out to Bonnie.
Well, thank you, everybody, and everybody have a great day. And thank you again, Sophie, and PAC 14.
Yes, thank you.
Yeah, have a great day.